What's up, everybody? My name is Faith Percival, and I'm originally from Port St. Lucie, Florida. I received my Bachelor's of Science in Health Education here at UF, and I'm also currently a student of the College of Pharmacy at UF. And I thought I'd just let you know a little bit about my involvements during undergrad, as well as answer some questions that you guys may have. So let's get started. So one of my biggest involvements was being a mentor for the MFOS program. I did it for 2 years. Through this role, I was able to have a lot of interaction with the MFOS office. I also was a peer leader for First Year Florida, and I was able to co-instruct 2 classes with Richard Blake. I think this was one of the best experiences that I could have done because I had that opportunity to really interact with first year students during their first semester and just get to help them be successful students here at UF. I was also an ambassador for the Office of Admissions. Now it's currently known as the Student Admissions Officer Organization. But that was a really great way of interacting with students, whether they were admitted or prospective students. We had a program called Gator for a Day where we scheduled high school students to come shadow a current UF student. And then I also was a teacher assistant for Organic Chemistry 2, and one of my last involvements was being a Gator 2 ambassador, which was a part-time job that I did during preview, and it was an opportunity to let family members know of a program that they can be a part of that also helps them feel like they are part of the Gator Nation, because obviously the involvement of our family members is an important aspect to make sure that our students are successful here. So the biggest advice that I could give a scholar is whether you're interested in a career in pharmacy or any type of healthcare profession, I would definitely say to reach out to your resources, whether that be your pre-health advisor or joining a pre-health organization. You know, being here at UF, we are fortunate to have all the health profession colleges in one place. So get in contact with current students in those programs, attend open houses that the colleges hold, and also see what it is that interests you of the profession and do some volunteering. And even if you don't know exactly what profession you want to follow just yet, I would say to take the science courses that are a common requirement amongst all the programs. That way you cover all your bases and that not be another stressor for you. My experiences at UF shaped me into becoming the person I am today. I faced many challenges, whether it was with classes or my personal life, but I learned how to become stronger through it all. My 4 years of undergrad gave me the time to learn more of who I was and what strengths I possessed and how those could make me successful. I also learned to not compare myself to others, but rather recognize how my qualities can make me be an asset to a team. The UF Pharmacy program is heavily focused on team-based learning, so I have had the chance of seeing how if each of us work based off our strengths, we can be a stronger team. So when I started at UF, my goal was to attend medical school. My sister, who is a family physician, was a big influence and role model in my life, so I wanted to follow her footsteps. So one semester I decided to take a course called Medications and Health, and it was an elective under the College of Pharmacy. This class was so interesting to me, and it was my first exposure to the field of pharmacy. And I would say that this was a defining moment during my time in undergrad, because I realized there was another way you can impact the care of a patient. A pharmacist does more than just dispense medications. They are the most accessible healthcare provider for patients when they have questions about their medication or condition. And as a part of the healthcare team, pharmacists can help physicians decide which kind of medication is most suitable for a patient that can have the least amount of side effects as well as drug interactions. And this really made me decide to follow this path. So I would say that one of the biggest things that surprised me as I went from undergrad to professional school was I thought that experiences of being in student organizations would also be a thing of the past. However, specifically in the pharmacy program here, student organization involvement and leadership continue to be an important aspect of professional school. If you're interested in a residency program after pharmacy school, having those leadership roles and experiences in pharmacy student organizations will help you prepare to be a strong candidate. So, although you do not necessarily need to have experience working in a pharmacy setting, it is important to be able to understand the various opportunities that are in pharmacy and be able to talk about the current issues that are seen in the medical field and what the role of the pharmacist is to face those issues. And that's definitely an important key point to talk about during your interview process or application process. So my program is a little bit different from how undergrad classes are and how other pharmacy programs are like. Each of our weeks, our class schedule varies. So one week we'll have class 3 times a week, or sometimes we only have class twice a week. But they give you your entire semester schedule at the beginning of the semester so you can plan your meetings and job shifts at work accordingly. Like I mentioned before, the UF Pharmacy program has a team-based learning curriculum, so I would say 75% of our material is done in a team setting. Also, we have something called active learning sessions as opposed to in-class lectures. And the way you prepare for those active learning sessions is by watching your lectures online and reading your material prior to class, and then once we're in class, we apply that material to activities and patient cases within our team. Since I like to have consistency, I try to get to school every day at 9 a.m., whether we have class or not, just so I can keep a consistent schedule. When we do not have class, you can usually catch me in the library studying alone or with friends. But one of my favorite things is that if you are involved in a pharmacy student organization, the college has specifically set a time aside during lunchtime for meetings and events to take place. That way you can attend them. So I will say professional school is definitely a whole different ball game. So during undergrad, we took classes that each taught us something different. And once we were done with the class, we kind of just put it in, the miscellaneous section in the back of our brain. However, in professional school, the material you're learning from day one will be information you will continue to use and reference throughout the program and into your career. So you have to remember it. As a pharmacist, one day you will be caring for a patient. So it is imperative to not study just to pass, but rather to make yourself the best pharmacist you can be. The information isn't necessarily hard, but it is just the amount of material that you have to take on in such a short amount of time can be overwhelming. I thought I had my study habits down pat when I ended undergrad, but I had to basically start all over and see what would help me be successful in my professional program. So some personal attributes that I think will help you be successful is if you're confident, if you're humble, and if you're a team player. Professional school is not easy, and some days you're gonna wake up thinking, if you're really made for this, and if you're gonna be able to be successful. And I think that's when you have to be confident within yourself, within your qualities and your strengths, and remember that you got into this program for a reason, and that also applies to your time in undergrad. And being humble, I think, is also important because whether you're in the medical field or in another profession, you're bound to be working with others, and we're not always perfect. So if you know that you've made a mistake, and being humble is going to help make people trust you more, you're going to have better relationships with others, and that's definitely going to be important when you're working. Now, I will also say that being a team player comes into play with that because being a team player means that you have to be accountable. You have to be responsible. Others are going to be counting on you, and if you don't have your part of your job or assignment done, whether that's finding the best medication for a patient, then you're not going to get the best outcome that you can. Well, that's all that I have for you today. I hope that some of the things that I talked about gave you some insight and some guidance. If you have any other questions about pharmacy that you want to know about, you can definitely reach out. So I wish you all the best. Bye.